Welcome everybody to the Open Learning Campus Social Enterprises Innovations team of the World Bank. Good morning from Washington, D.C. Good afternoon, good evening to all of you participating with us. It's a pleasure to be chairing this webinar, and it's part of a course on Innovative Business Models Health Edition. This webinar will focus on how our invited guest, Zeena Johar, a social entrepreneur working in rural India, used principles of collaborative leadership in her enterprises, which was able to reach over 70,000 patients with a network of 9 clinics. Zeena Johar is founder of and CEO of Suga Vasu Healthcare, SVHC, and ICPTH, organizations that work to create primary care delivery networks through rural clinics. The clinics rely on affordable healthcare technologies and trained Indian medical practitioners to provide basic healthcare services for rural populations in India. Zeena earned her PhD in molecular diagnostics at the Swiss Federal Institute of Technology, and she currently is pursuing a program for leadership development of the Harvard Business School. Zeena is an Ashoka Fellow and Yale World Fellow too. So it's a pleasure to welcome you, Zeena. I know you're in New Haven, and I very much appreciate the time you've provided with us, and I'm sure all the participants are keen to listen to your experience and also to have the opportunity to interact and have questions and learn from how best they can apply the lessons that you've drawn from your experience. Before I hand the floor to you, I would just like to highlight that my role here is to moderate the discussion, but I would also like to speak to those in particular who are currently in the Innovative Business Models Health Edition course. And the purpose here is to try to draw from your experience some elements of leadership. And here I would like to highlight a few things that I'm currently looking forward to hearing from you. Is on the one hand, how and who exercise leadership in the different issues that you will raise, and also how is it that you were able to mobilize both internal stakeholders and external stakeholders to do things differently. We have found that one of the biggest challenges, of course, is mobilizing stakeholders, mobilizing agents, mobilizing the population to do things differently in order to get different results. And this generally goes beyond commitment, and of course, it requires us to have the capacity to develop actually commitment and not compliance. So go beyond compliance rather, and work towards commitment. So those are my introductory concepts, comments before I request you to please introduce yourself and to start the introduction. So Zeena, welcome. The floor is yours.
Awesome. Thank you so very much, Manuel. I'm absolutely delighted about this opportunity and really looking forward to sharing some of my thoughts in the next 30-35 minutes that I have with all of you. It is absolutely exciting to see the participant list build up on the side. So, you know, that's absolutely fascinating. So, is there, I'm hoping there is no echo and everything and I can go on. Okay, great.
We're hearing you well. Carry on.
Oh, excellent. So, you know, as I'm getting started, so what I thought that the best way for me to really, you know, share my time would be to split the time that I have with all of you into 2 big components. One is to really share my personal story as to how I went through you know, the journey of social entrepreneurship in the 8 years that I spent in that domain. And the second part of the presentation is primarily really looking at strategic insights from the work that I have done and then taking those strategic insights and building an operational strategy which can be executed on the ground. So these two, worlds I thought would be of relevance to the audience as we are really talking about collaborative leadership. Collaborative leadership for me, as you very rightly mentioned in your introduction, is all about identifying the right set of stakeholders, both internal as well as external, and then working with those stakeholders, as we are really implementing and developing interventions, scaling enterprises, and all of that. So let's just dive deep into the first component that I have, which is how did I go about really creating a healthcare enterprise in India? Let's just very quickly look at the 100,000 feet view of Indian healthcare. As a country, we have around, 1.3 billion people with only 1.2 million, with only, 400,000 doctors. We require around 1.2 million doctors in our country, and there is no way that with the 30,000 doctors that we produce every year, we will be really able to produce, kind of meet the gap. And hence we looked around in the world and we were very fascinated by the nurse practitioner model that works exceptionally well in countries like US and other developed economies. And that was one concept that we brought to India to really work with the deficit of human resources. The other interesting part is that, when you talk about healthcare infrastructure, of course, there's a deficit. The deficit is further enhanced by the fact that most of the medical infrastructure is in big cities. There is nothing which is really available in small towns or at the last mile or at smaller villages. And the other reality is that when we got our independence, we were really dealing with communicable issues, women dying, during childbirth, infant mortality being extremely high. Now, as you see the landscape transitioning, we have become the diabetes capital, cervical cancer capital, and the road traffic accident capital of the world. So how do you really reconfigure and realign healthcare systems to be able to deal with the rising chronic disease burden? So this is what we did. As I mentioned, we knew we didn't have enough people. There was very limited infrastructure which was available at the last mile, and there was very limited use of technology. These were the three gaps that we identified through our work and through the interventions that are listed right now on your screen. We really brought in effective solutions. So we brought in, Indian medicine practitioners who were trained as nurse practitioners in collaboration with the University of Pennsylvania School of Nursing. We developed our standardized protocols. We put together a health management information system. And we put together a very effective model of community engagement. And over 8 years, we established a network of 10 rural clinics and serviced around 75,000 patient visits, primarily trying to establish a market-driven model for last mile healthcare delivery. I will stop here with the work that we have done in rural primary healthcare and use our work as an example for all the other slides that I will be sharing with everyone. To say that in the work that I spoke about the components of identifying the problem very clearly, identifying the target audience with whom we want to work with as we have the identifying problem, really working in an innovative lab when we are putting a solution together, implementing that solution on the ground, piloting it, and then scaling it. Now, when you're talking about a social enterprise, the transition that one makes from a small startup, an innovative lab wherein you're trying out many new things, to an organization that goes to scale, that has national impact, has policy influence, there is a huge change in the operational excellency that the organization builds. There is a huge change in leadership that needs to take place as the organization is really transforming. And some of my slides that will follow are primarily, looking at three big concepts. When you have a critical idea, when you have developed a solution for that critical idea, when you're looking at scaling that critical idea, how do you develop strategic insights? How do you convert those strategic insights into an operational framework? How do you think through the challenges of managing supply and demand in your population? And then how do you really identify the target audience and work with them very specifically, which primarily brings us back to the point that Manuel made in the beginning of the internal and the external stakeholders and working with them. So, this slide primarily really is the take-home message for me, when you talk about collaborative, or as I call it, adaptive leadership, that one has to be extremely, extremely responsive to change within, your own leadership style in terms of managing teams, bringing in people, scaling an organization, and very, very adaptable to both the internal and the external requirements of the market. And that, for me, for the 8 years that I led an organization, have been the key insights as a leader, as a founder of an organization. This is a very simple slide, something that we all know that, how do you really build a concept into a mature, scalable organization? Now, when we are thinking through these stages of transition, everything from the people that are required, from the skill set that is required, from the commitment that is required, are very, very different. And at every stage of this evolution, we need to make sure that we have the right skill set, the right people, and the right leadership style as we are really evolving through. Now, very often I have seen, it's a very simple concept of dynamic conservatism. Now, what does this really mean? What this really means is what this graph very easily explains, is to say that when you have a value proposition, when you've built something which you know it works, the organization in itself becomes as the highest source of friction, resisting change. So the biggest thing that one has to change are the internal stakeholders as you're working towards evolving the organization to the next set of challenge. How do you go about really dealing with or confronting the situation of dynamic conservatism? Now, when we're really talking about how do we really think about a coherent business strategy, which is well aligned with the industry and gives you a long-term, influence on the existence of an organization. So for me, the core concept, which I feel is an extremely simple model to use, is a model called the congruence model. This is a model which I feel, whether you're talking about the mainstream automobile industry, or you're talking about healthcare social entrepreneurship, or you're talking about education, really brings together all the basic concepts that are required on a sheet of paper very easily, and then really helps us distinguish between the two, axes that I've shown, which are the hardware and software elements. Let me very quickly walk you through how to think about building a strategic framework for our organization. So what is really most important in any organization? Leadership is key. It does not matter which frame of reference you're looking at. Leadership is key. Strategy is key. Execution is key. And strategy and execution talk to each other through a set of core values that an organization really abides by. Now, this is easily said than done, but how do we really go about thinking? So leadership is a set of people who really bring in their vision and are really driving the organization to excellence. When you're talking about building strategy, what are the 4 key elements of really putting together a coherent strategy? Driven by market insights, wherein, as I spoke about my own example, wherein I was talking about identifying a gap in Indian healthcare. Strategic intent, which is how we went from identifying the gap of not having enough doctors in India to looking at nurse practitioner models which could work in India. Business design, wherein we took these nurse practitioners, enabled them with technology, wrapped around a business model around it, wherein people were paying a user fee, to a focus on innovation. Now, so what was the innovative focus? We did not have the coolest drug in place. We did not have the coolest technology in place. So when we're talking about innovation focus is primarily really, in our case, looking at bringing in models that have worked very well elsewhere, having a very clear understanding of the local context, which is India, and then developing and scaling functional models for the target audience that we had in mind, which were villages in south of India in the state of Tamil Nadu. Now, those were the strategic insights. Now, let us come to our story, which I shared with you in terms of execution. So how did I take my market insights, my strategic intent, my innovation focus, and translated that to execution? You need people. You need a very clear understanding of how those people will be configured within teams and how will those teams interact, because I do have a slide on different types of teams. Depending upon the kind of interaction that you expect to see between your people, you need to have different formats in which you really manage them. And then very often it's important to understand the critical interdependencies that you see between those people. Most often things which are overlooked, because when we're talking about social enterprise, everything is driven by passion and commitment. But what is very important is for the senior leadership to be very, very cognizant about the culture that we are building in an organization, and how do we really go about maintaining a reasonable culture. So this is primarily talking about a leadership team coming together, developing a strategy, translating that strategy into an executable operational format, and then really taking it to scale. So now I have a great idea. I have a team that can implement it, but how do I really think about supply and demand? So when I'm thinking about supply and demand, and I think that again comes back to our experiences of running an enterprise. So I got my PhD from Zurich. And, when I came back to India, I was absolutely, struck by the healthcare inequality that exists in our country. And I did want to work very hard in putting a workable model together. Now, as a PhD, the kind of training that I got was to say that if there is a problem, and if you identify a solution, and if you put the solution next to a problem, everything else will happen on its own. And that's what we did. So, we identified the challenge. We worked with University of Pennsylvania, brought in the nurse practitioner model, got in the right technology, put together the most fascinating infrastructure. To our surprise, the community did not respond the way we expected them to respond. And that to me was a very overwhelming and a humbling experience. To say that, when you're thinking about an enterprise, necessarily focusing on the supply side of the intervention is most often not good enough, So how do you really think about the demand side of the intervention? Again, going back to how do you optimally balance the focus of an organization on the internal stakeholders and the external stakeholders, so that there is a reasonable balance that you can maintain both on the demand side, which is stimulating the demand side, and managing the supply side, whether you're bringing in the best innovation, whether you're bringing in new business models, whether you're bringing in process innovation. So to me, there are primarily three big buckets in which I would want to put this, which is creating value, which is primarily looking at supply side interventions, capturing value, which is when we begin to very clearly identify our external stakeholders and start facilitating a purchase, whether we are talking about market awareness, whether we are talking about, really working with them in facilitating a purchase. And then we are talking about sustaining that value. Creating value is great, and sustaining, capturing that value is fantastic. But sustaining value is all about, are we really very responsive to the indicators that we are getting from our external stakeholders? And how are we changing, adapting to the evolving needs of our external stakeholders? I think is the most challenging aspect that we have as a leadership team, whether we are talking about a social enterprise or we are talking about a mainstream enterprise. So not getting into too much detail, but I wanted to really share some key aspects, which is primarily really looking at when you talk about marketing, when you talk about really, presenting your value proposition, whether it is a better healthcare technology, whether it is primary healthcare, whether it is basic education tools to your client population. How do you really think through? We are not talking about a marketing campaign that shows up on national television, but we are talking about a marketing campaign wherein, from our own work in healthcare, we identified schools as a very relevant area for us to go, engage the audience early on so that they understand the downside of people smoking in their family, so that they understood the benefit of iron-rich iron-rich diets, and they understood the compliance of having iron supplementation for a pregnant woman who they might see in their family. And that to us are the core principles of marketing, saying that, when you have your customers whom you identify, to whom you're providing a service, which are the various channels that you can work through. Schools is one example, the local social structures. So for us, whether we were talking about basic primary healthcare services, or we were talking about diabetes care that we were really providing to audiences in our geography, what was most important for us was to really understand that what are the key social networks that we can tap, and those social networks are essential, and really understanding that which component of that social network do we need to tap and maximize is I think very relevant. And those, I think, are key aspects of marketing that one needs to think through as we are really taking our operational strategy to scale. Now, in the very beginning, when I was really presenting the operational framework of the strategic, insight that we built in, I spoke a little bit about teams and organizational culture. And this to me is a very basic understanding of saying that what are the different types of teams that one can see in an organization. So oversimplifying it for sure, but there are ways in, sometimes when you have modular teams, say for example, Taco Bell as a store, wherein you have one intervention followed by the second intervention followed by the third intervention, and the three teams don't necessarily need to collaborate or work with each other. That's because their jobs are very independent and they can do their stuff and either hand it over to directly the client or hand it over to the next team. The second team, which most of us are very well aware of, and in most of our work this is what we really experience, are the sequential teams, wherein one team finishes a task and hands it over to the other team. The third, which is the most complex team, is the reciprocal and collaborative team. And in most of our work, modular teams are relatively few, but we see a good mixture of sequential and collaborative teams. Now, when we are really talking about sequential and collaborative teams, the most obvious thing that will come to our mind is to make sure that the performance indicators that we have for various teams are configured in a way that they reflect their interdependency, and that interdependency then, if you maximize your performance indicators, will kind of work very well. Now, that's one way of thinking about it. What about other aspects of, really thinking about culture? So culture for me is primarily driven by the core values. When I was talking about the strategic insights and the operational framework, at the bottom I put core values. And to me, core values is what distinguishes one company from the other, what distinguishes one leadership team from the other. And if you really look at a very simple framework of how values really, drive the behavior, it's primarily really driven by the acts of senior leadership. How do they work, talk, behave, their actions, and how consistent are they in terms of being aligned with the overall mission? Then, of course, there are, enough examples to say that how are you really building your teams? How are you promoting your teams? How are you training your teams? But at the end of the day, the onus of culture in an organization comes down to that of senior leadership and the reflection of senior leadership in terms of the values and norms and their reflected behaviors within a given organization. Now, to me, I think what I was very fascinated by, and I will share this personal example that I have with you in terms of saying that when you have culture and norm in an organization, how can they deeply influence, the outcome of an organization? For many people who are present in the US are very familiar of this chain called Nordstrom. And Nordstrom is, of course, very famous for the customer interaction that they offer. Now, if I were to join Nordstorm today, the thing that you see on the left is the rule book that I'm given, wherein as an employee, I am given just one rule, which is to say that use your best judgment in all situations to service a client. To me, is a very simplistic view of how strong culture and informal learning is one way or one set of doing things, which is the example of Nordstorm that I presented to you. On the other hand, a weak culture and formal learning, wherein you have lots of rule books, you have ways in which you manage everything, everything is written down and there's an indicator for it. I wouldn't say that there is one right or one wrong in terms of whether it should be strong culture, informal learning, weak culture, formal learning. But in that continuum, the role of the senior leadership is to clearly identify that where do we best fit in terms of the formal organization that we are really talking about. When we're talking about healthcare, for example, the ethics of delivering healthcare, the medical protocols of delivering healthcare really are very tightly linked to formal learning. You cannot say that you should do whatever you feel like doing with a client, because then, I am defeating my first principle of being able to provide ethical healthcare to my clients. But when I'm talking about who gets care, who doesn't get care, a lot of that is a part of the strong culture that we held as an organization. The fact that nobody in our organization who came to get healthcare was ever denied healthcare, whether they could pay or they could not pay, I think was an indicator of how strong culture really emerged in an organization. And to me, as I reflected in my previous slide as well, this is the most important component that leadership needs to keep in mind as they are adapting or taking an organization through to scale to other places, to other geographies and all of that. Now, this is again, when you're talking about, I spoke about how to manage culture, and when I was talking about managing culture, I spoke about formal culture and informal culture. But you need to make sure that on that continuum, there is a healthy balance that you maintain between the organizational fit with culture and values and the performance. And on this, 2x2, it's a very simplistic view for one to analyze and see that when you have people who are very aligned to your culture and your values and are doing exceptionally well, those are primarily the people whom are the ones who would form the second line and the third line of management within your organization. When you have people who are extremely well aligned to your culture, but are struggling with performance, are the people who need a lot of training and a lot of hand holding so that they can really move ahead and go forward. You always have a small set of outliers who are neither aligned to the culture nor are really demonstrating the performance. Those have to be managed in a stern way. And these are always extremely difficult decisions, for a senior leadership to take. You often have people who are high performers, but have low association with, the culture. For those, I think they need to be handled even more carefully with the senior leadership as you align them to a mission and make sure that their high performance echoes the mission of the organization extremely well. So this was primarily saying that, you have an idea, you scale an idea, you think about ways in which you manage your business insights, create operational structures, and take them through. Now, most often, the organization or the problems that we have at hand are not as straightforward. An organization, as we call it, is most often an ambidextrous organization, which means that it is doing innovation at the same time as is it scaling and operating a strategy. And the two often have to exist together at the same level. And the skill set which is required within teams that are innovating, within teams that are executing, are most often non-overlapping. So how do you really think through, two different organizations, two different verticals, 7 different strategies in an organization, and say that how do I make sure that I have great efficiency, better processes, and very tactile operational strategies on the operational arm, whereas I have a lot of experimentation, lots of failure, lots of resistance, lots of resilience in the innovative arm. And that to me had been the biggest challenge, when you're talking about leadership, because most often the leadership team is the same at the very top. And you have to kind of sway between the operational focus to the innovation focus and think through how the two pieces come together and how the two pieces really interact with each other, which is what I spoke in the beginning, when I spoke about different types of teams in terms of modular teams, in terms of sequential teams and collaborative teams. So not going too much into the detail, and this is primarily, one of the few closing slides that I have. So in my conversations with Manuel, when we were preparing for this webinar, he asked me a very interesting question, that as a social enterprise, how do you maintain a healthy balance between compliance and commitment? And that to me was a core question that almost every social entrepreneur struggles with. To me, not oversimplifying it, but a good answer is to really look at the fiduciary responsibilities that an organization needs to deliver, both in terms of financial responsibilities, both in terms of your responsibility and your commitment towards the board who's supporting you, most importantly, towards the target audience that you've selected for yourself, to say that if this is the value proposition that I wish to offer, how do I make sure that this target audience is receiving everything that I've put together at a value proposition at a cost which is effective and makes sense for the business model that we've put together. And I think for every organization early on, to think through the fiduciary responsibilities and not have a complex set of 50 responsibilities listed, but let's at least 3 big responsibilities. When you're talking about financial responsibility, when you're talking about your responsibility towards the board, most importantly, and something that should come on the top, is your responsibility to your external stakeholder, in which case, in our case, it was primarily, say, the geriatric population to whom we were really providing diabetes care. And using the lens of fiduciary responsibility, I feel gives a methodology to arrive at a very healthy balance between compliance and commitment, which is a question that social entrepreneurs struggle from the day they start an enterprise to the 10th year of that enterprise. So primarily, just closing my presentation is to, I just want to take a couple of minutes to wrap what we really discussed. So I started with my own healthcare journey as an entrepreneur and how I identified a gap and worked through that gap and built an intervention around it. We then stepped back to really look at congruence model as a method to bring together strategic insights driven by the market, and then translating them into an operational methodology, which is primarily driven by the core values that are endorsed by senior leadership. Now, once we have a congruence model that tells us that this is the value proposition that we want to take, how does one maintain a very healthy balance between the supply and the demand? How do you really swing from creating optimal value to making sure that there is a very significant uptake of the value that you have created? Having done that, the most significant question that, of course, you want to answer early on is to maintain a very healthy balance between commitment and compliance. And using the framework of fiduciary responsibilities of an organization to define those core values and make sure that those are kind of reflected in the congruence model that we spoke early on in the beginning. So these were primarily the insights that I wanted to share. And many of these things are, very easily expressed through frameworks. But having been an entrepreneur myself for 8 years, much of this thing is about doing things on the ground, learning, failing, and failing again, but just not giving up and then coming up with version 2 and version 10 and version 20 and staying with the task, which eventually does lead to something very useful and promising. So thank you so very much for your time and attention. And yeah, I'm delighted to now engage with all of you in with questions that you may have. And Manuel, I would love to hear your feedback as well.
Great. Well, thank you very much indeed for a very sharp and precise presentation. You've drawn the attention of many of the participants, of course, and there are many questions that I'll try to synthesize as best I can. Before doing that, I'd like to make just some general comments of what you mentioned that I think might help think through some of the issues on the leadership piece at least. One of the things that you mentioned, and I'd like you to reflect on a little bit more, is you have this proposal that there are problems and there are solutions. And once you identify the problem, then you have a solution. I'm wondering if, in the complexity that you're working in, if problems can be so easily defined. And perhaps you don't actually have solutions, but you have proposals and you learn on them, and there's an iterative process. And therefore, there's progress being made rather than problems being solved. So that's a question I have to you regarding the way you're phrasing the issue of problems and solutions. You did identify some gaps, and you had some proposals and methodologies to go forward. One of the issues that you highlighted is that I think you said that you were very surprised by the way the community reacted to your proposal, and then you went speaking about the importance of tying up the supply side with the demand side. I would like to ask a little bit more on what exactly were the mismatches that you found, and how is it that you interacted with the community beforehand? How did you identify stakeholders? What methodologies did you use, particularly the external stakeholders, and what type of relationship did you have and you develop with them that enabled you to mobilize them? So that's an issue regarding the stakeholder piece. Another one is when you have the model, when you put a slide up, perhaps if you could be kind enough to go back to the slide that has operational on the one hand and innovation focus on the other. On the left-hand side, you had all the operational issues, and on the right-hand side, you had the innovation focus. I would like to suggest that it's actually in the operational side, you're really speaking mostly about management issues, where you're trying to become efficient, you're trying to get results, you're looking at metrics, and probably problems are more of a technical nature. There is experience on how to address them. On the other hand, you have, on the right-hand side, sorry, you had the innovation focus, and that's it. That's the slide. So if you look at the operational focus side, that's really a management challenge. Efficiency, better processes, there are small changes, you're looking at tactics, you're looking at operational metrics. On the right-hand side, you have the innovation focus, and I like to suggest that this really is where the leadership challenge comes up. And all managers, of course, aren't people who exercise leadership, and this is why the whole idea of who exercises leadership is interesting. Some people might be very good at managing, yet you need other people who also have the capacity to exercise leadership and move towards the innovation focus. So these are some general comments I have to your presentation, and perhaps my general request would be if you could illustrate these with some concrete examples of problems you had and how did you overcome them. I think you've presented a very interesting overview, and I think it'd be useful if you could now deep dive a little bit to give us some very concrete examples of issues, difficulties, challenges, and how you addressed each one of them.
Thank you so much, Manuel, for your comments and your insights. Very, very relevant, and primarily summarize most of what I wanted to communicate very crisply. So thank you so much for that. So the first question or the first comment that you made around problems and solutions and how the two primarily are driven by each other through a very iterative process, because in the example that I shared, I was primarily talking about the problems that we identified and the solutions that we constructed around it. It almost feels like a unidirectional process, but if you ask me, the process has been very, very iterated. Now, let me give you an example of that. So in our healthcare work, when we got started, most of our work was, primarily talking about providing basic primary healthcare services for a basic user fee. So we used to charge clients every time they came to our clinics. They were paying us a user fee. They were paying for the diagnostics and the drugs that we were providing to them. Very quickly, we realized that in our value proposition, most of the clients are coming to us for chronic care conditions. Now, when I speak about chronic conditions, I'm speaking about patients suffering from diabetes, patients suffering from hypertension, all of those. Now, we were very happy that we were servicing the chronic patients of our population because that was primarily the vision of our organization, to focus on chronic care. To our surprise and disappointment, we lost almost all of these patients suffering from chronic diseases in 6 to 8 months. The key takeaway that we realized was the reason why we are losing all of these chronic care patients is that we had a very transactional nature of providing healthcare to them. And hence that kind of brings me to the second point wherein you were talking about the operational strategy and the innovation focus. So we realized that the value proposition that we've put together is not necessarily servicing the client the way it should. And hence we innovated on the financing model and said that we need to move away from a user fee driven model to a subscription fee based model. And this to us is a perfect example of how the operational focus, which is primarily driven by key performance indicators, executing a key strategy, to the innovation focus that you have in an organization. How do the two constantly work in good, synergy with each other, and how do we really implement them? So we did see a gap. We put together a healthcare solution. We realized another problem as we were executing our strategy. We innovated on our, financing mechanism. And that financing mechanism brought back most of the diabetic patients that were falling off, our patient management strategy. And that to me is a clear indication of how within an organization you keep that ambidextrous outlook, which kind of manages the innovation part plus the operational part and ensures that constantly the two of them are talking to each other and that the demand is very strongly influencing the supply of relevant solutions.
Great, thank you very much for that. I will try to synthesize some of the questions that are coming up. One of them has to do with how is it that you were able to identify the specific challenges, because you faced a series of problems. So how is it that you identify a specific challenge, and how is it that you prioritize to try to address it? That's one set of questions. The other questions also address the whole issue of how is it that you did engage? That was part of my original intervention too. How is it that you engage with the external stakeholders? If you could address a little bit more, for example, what is it that you learned regarding the fact that they didn't attend the community centers, and also the whole idea of what would you do differently if you were going to do this all over again? What are the key learnings of doing differently, and if you could perhaps share a particular area where significant change would have happened in light of your experience.
Thank you so much, Manuel. These are again a very interesting set of questions, and I would love to share my insights. So your first comment that you make, that how do you really go about identifying the challenges? I think most of the challenges are very evident on the surface, when you talk about not enough doctors, not enough good healthcare. For me, what has worked very, very well, and the strategy that I would very strongly recommend, is to really, take the time to closely map the market to the next best possible option which is available for the clients. When we started really building a hypothesis for our organization, for us to have a clear sense that what is the government sector doing, what are the alternate options that are available to our population, and when we are talking about other interventions in the private sector, what are they doing? What has worked? What has not worked? And I feel taking anywhere between 3 months to 9 months of the initial phase of an enterprise in very clearly defining the problem, very clearly mapping out what others have done and others have and things that have worked for others and things which have not worked for others, and be very cognizant about those those lessons as we are putting our solution together, I think is very relevant. Now, the next point that you were really making about is how do we really engage external stakeholders. This to me again is a very iterative process as to first how do you identify the external stakeholder, because when we started our work was primarily to say that we will provide primary health care to our people. Now that's a great idea, and when you look at the village, it's a good basic unit to have in mind to say that, okay, I will be talking to villagers, but villagers have a complete distribution of socioeconomic, wealth distribution. They have a distribution of age. There's a distribution of gender. So who exactly is your target audience? So for us, getting started from, in the beginning of an organization, from providing healthcare to moving to a chronic care provider, to within chronic care provider, then identifying the entire spectrum of who are my early adopters and who are my laggards and who are the ones who we will never be able to convert to our value proposition. And I think taking the time to map, which primarily happens as you are implementing interventions, it is tough to do this work beforehand. I think is very useful. I think very clearly defining your value proposition and refining that value proposition to a smaller and a smaller and a smaller and a much more targeted audience really helps an organization build the efficiency that they want, because at the end of the day, the long-term success of an organization is not determined by how many first-time purchases happened, but how many repeat happened, and how many of those repeat purchases continued to happen over a period of time. The third question that you asked, as to if we were to start over again and do things a little bit differently, what is it that I would have done differently? So the presentation that I shared with everyone has primarily been, my 8 years of journey, first as a social entrepreneur, then taking the time to coming back to school, learning many of these business principles, having standard frameworks to work with, and really understanding the benefit of an iterative process as we're building an organization. I think took me a really long time to, put together. Now, when we are really talking about, executing things on the ground, I wish I had access to these tools early on and I could get into this process of iteration much earlier so that, I could fail much faster. It took us a really long time in the early years to move from problem identification, putting together a solution, implementing a solution, and then having that functional feedback loop before everything really worked. But to be able to do that early on, very quickly, through an appropriate set of tools which are made available to you, resources like the World Bank is now offering through the Open Learning Campus, I think are absolutely invaluable. I wish I could say that 2 years as an entrepreneur.
Great. Well, thank you very much indeed. So it's very refreshing, of course, to hear from a practitioner like yourself that conceptual frameworks and tools actually do help in real implementation. But it's also important, of course, to have the willingness and the learning capacity to actually benefit from failure and be able to improve on account of that. There are a couple more questions coming up, and I think the general gist is, how is it really that you go from 1 clinic to 10? Could you walk us through a little bit what was the expansion process? Because I know you ended up with the 10 clinics, but what exactly was the step-by-step, if you will, briefly, and some lessons from going from 1 to 2 to 3, or however the process was?
That's a great question, and I think makes for an excellent question close to the end of our presentation as well. So when we launched our first clinic, when we were doing that, we were more like a lab. We were a set of very passionate people, very driven about a certain set of ideas, really wanted to make a change, and everybody was doing their very, very best to get things done. We put the first clinic. Many things didn't work, whether we're talking about financing, we didn't have a community engagement strategies in place. So I think that was more an experiment lab, like you're doing an experiment in the lab, which worked, which failed, and we kept changing. Then we, added a second clinic to it to make the problem a little bit more complex. But then what we did after the second clinic was to say that, okay, now let's spend the next 4 months really, strictly strategizing that in the 2 clinics, what has worked and what has not worked. And at that point is when we saw a huge strategic transition from doing things all driven by passion and commitment by a small set of people to bringing in operational parameters, performance management dashboard, training manuals, standardizing most of our experiences. And that was the biggest leap that our leadership team had to make, had to adapt to, as we moved from an experimental lab wherein everything was very driven by the commitment of a handful of people to doing and trying many, many things, to now scaling. So things that we very clearly knew worked, and not scaling things that we very clearly knew didn't work. So, that when I was talking about, if there was a simpler way of explaining, that would be that when I presented the slide of an ambidextrous organization, which is a mixture of innovation and operation, when we got started at Clinic 1, we were 99% innovation organization and 1% operational organization. As we moved to Clinic 5, we became 20% innovation organization and 80% operational organization. And making that transition wherein, the focus of our organization on operations moved from 1% to 80% was the biggest transition that we made, and one of the most crucial lessons that we learned around adaptive leadership.
Great, excellent. Thank you very much indeed. I don't know if you're having an opportunity to read the comments that are coming up in the comment box, but as you can see, participants are extremely satisfied and very thankful for your honored sharing of such rich experience. The previous question was, how did you go from 1 to 10? And I'd like to end, perhaps if you'd like to share with us, what's the future holding now? You're already at 10 clinics. Do you keep at an operational efficiency of 10 clinics? Or are you thinking of expanding, and how so? What's your most pressing challenge right now?
So right now, what the organization is really trying to do is, to look at inorganic ways of growing, So when we really grew the organization, we came from clinic 1 to 10 very organically, adding one after the other and then after that. Now the organization has changed its focus and it is looking at inorganic methodologies to, really scale. Now, what do I really mean about inorganic methodologies? So for example, recently our organization signed an MOU with one of the largest colleges, medical colleges in India, to scale our, training program. The other thing that the organization is wanting to do is to look at partnerships with, say, for example, Apollo hospitals in India to replicate the network of clinics around many of their hospitals. So one of the key lessons that I would want to offer over here is that when we got started from an idea on a piece of paper to an experimental lab to standardizing much of our learning, scaling it through an organic methodology. What we are doing right now is are exploring inorganic pathways to scale much of our learning.
Thank you very much indeed. Again, I want to highlight the practical issues that you brought on the table. The importance of being able to learn in the process, have a perspective to take a look from the balcony, if you will, and really reflect upon what you've done, and on the basis of that, learn and move on. I want to thank all the participants that have generated some very interesting questions. I know that the webinar will be available later on. And also thank you, Zeena, once again, and all participants from the Open Learning Campus and the Social Enterprise Innovations team. So thank you very much, everybody, for your participation. And I would like to please request if you could fill in the survey. There is a survey that we would like you to fill in so that we'd have the benefit of your inputs in order to improve our webinars. Zeena, it's been a pleasure. Thank you very much. Goodbye from Washington.
Thank you so much.